Good morning, and thank you for having invited me to this international Rett Syndrome meeting. Today, I'm going to talk about epilepsy in Rett Syndrome. Epilepsy is one of the major issues for clinicians and also for families of people with Rett Syndrome. What is epilepsy? Epilepsy is a chronic non-communicable disease of the brain that affects around 50 million people worldwide. Epilepsy is characterized by the recurrence of seizures, which can involve part of the brain, and in this case, we talk about focal seizures, or the entire brain, and we talk about generalized seizures. The seizures can be associated with loss of consciousness and different clinical signs. Indeed, the epilepsies comprise a broad group of disorders with different etiologies, electroclinical presentations, and also marked variability in their clinical outcomes. In patients with intellectual disability, the prevalence of epilepsy is around 20% compared to 1% in the general population. So epilepsy is the most common health need in this population. But especially in intellectual disability, not everything that shakes is epilepsy. And so the differential diagnosis of paroxysmal events may be particularly challenging. And this is the case of children and subjects with intellectual disability. And this is particularly the case of people with Rett syndrome. We know from this historical paper by Dr. Glaze that when we monitor patients with Rett syndrome with video EEG recordings, a high number of typical seizures, 42% of typical seizures, were not associated with a clear EEG discharge. So what we think to be an epileptic seizure, as a matter of fact, is another event, especially when motor signs are present or when there is a behavioral arrest, staring, breath holding spells can be misinterpreted as epileptic seizures. So first of all, we should be aware that people with Rett may show different paroxysmal events, and not all of these events are seizures. When we look about epilepsy in classic Rett syndrome, such as in this paper dealing with more than 1,000 female patients, we found that around 70% of patients with Rett may show epilepsy, and around 30% of these patients has a drug-resistant epilepsy, which is in line with other population with epilepsy. In this longitudinal study by American authors, the prevalence of epilepsy during the lifetime of people with Rett approach 19%. And as a matter of fact, only a small percentage of women with Rett syndrome, 30%, were seizure-free and off anti-seizure medication. So epilepsy can accompany the lifetime of people with Rett syndrome, and only in a small number of cases we can take off medications without recurrence of seizures. About the management of seizures in patients with Rett, we usually use conventional anti-seizure medications, especially carbamazepine, valproic acid, or lamotrigine, depending on the semiology of the seizures. In this study conducted on Italian patients with Rett syndrome, we found that lamotrigine could be particularly effective in patients in whom epilepsy started later than typical age. And also we found that the association between valproic acid and lamotrigine could be a good option when seizures are drug resistant. We also know that in classic Rett, epilepsy have different characteristics depending on the age of the patients. And so in younger girls, seizures can be treated with a monotherapy, in most cases with valproic acid. Then between 5 and 15 years of age, seizures are more frequently drug resistant, and we need to use more than one anti-seizure medication in association. But after 15, 20 years of age, seizures are usually better controlled, and the most used anti-seizure medications are carbamazepine and lamotrigine. What to do when seizures are drug resistant? Indeed, in the last years, the introduction of new anti-seizure medications allowed to improve seizure control also in subjects with Rett syndrome. We have data about the use of levetiracetam, zonisamide, topiramate, lacosamide, perampanel, or rufinamide as add-on medications in patients with Rett syndrome and drug-resistant seizures. We all know that anti-seizure medication may have side effects. The spectrum and the rate of side effects of anti-seizure medications in people with Rett is comparable to what we see in other patients with epilepsy. But people with Rett syndrome may show the presence of comorbidities that can pose some difficulties in the choice of the drug in order to not worsen their quality of life of girls with Rett syndrome. So we know that valproic acid may increase the risk of fractures, that levetiracetam may increase their irritability, or benzodiazepine may worsen respiratory function and increase somnolence during the day, thus reducing alertness and participation to daily activities. So we should be aware of these side effects and take them in account in order to decide the best treatment for each patient. In the very recent years, the introduction of cannabidiol and its derivate has brought new hope for the treatment of drug-resistant seizures. And specifically in girls with Rett syndrome, we have some initial information regarding the use of cannabidivarin, which is a derivative of cannabidiol, in a small number of patients, only 5 children up to now, but this drug reduced the frequency of seizure and showed only mild side effects, an increase in somnolence and in drooling. So in the future, the possibility of using cannabidiol also in patients with Rett will be also considered. In patients with drug-resistant seizures, we can also use alternative treatment for epilepsy, such as ketogenic diet, which is a high-fat, low-carbohydrate, adequate protein diet that can be prescribed in patients with drug-resistant seizures. The ketogenic diet is compliance demanding and requires a high degree of medical and dietetic monitoring. So it can be used only in a small number of patients. Another therapeutic option is vagal nerve stimulation, which requires a surgical implantation of electrodes around the cervical vagus nerve connected to a stimulating device implanted under the anterior chest wall. Vagal nerve stimulation has been used in patients with Rett, and it was safe and effective, and it also improved their quality of life. So this is another therapeutic option that can be considered in drug-resistant seizures in Rett. Only few words about epilepsy in CDKL5 deficiency disorder. In this disorder, epilepsy is often severe with early onset seizures. Seizures are typically polymorphic. That means that a patient can show different types of seizures, epileptic spasms, generalized tonic seizures, focal seizures, myoclonic seizures. So the treatment depends on seizure semiology, and almost all anti-seizure medications have been used in CDKL5 deficiency disorders. We know that ketogenic diet may be effective in these patients, and also cannabidiol can be particularly effective in CDKL5 disorder. So cannabidiol should be offered for epilepsy according to the regulatory requirements in each country. In CDKL5 disorders, we also know that subjects may show periods of honeymoon, so periods during whom patients are seizure-free for weeks, months, or even years. And this may be initially related to a specific anti-seizure drug, but this is a characteristic of the disorder itself. So, as second messages, epilepsy is a prominent symptom in people with classic Rett and also in CDKL5 disorders. The majority of patients usually reach seizure control with conventional anti-seizure medications, but up to 30% of patients is drug resistant. And in patients with drug-resistant seizures, new anti-seizure medication could be potential aids, as well as ketogenic diet and vagal nerve stimulation. At the moment, regarding cannabidiol, we can only rely on preliminary findings in girls with Rett, but this drug may offer a new treatment option for people with Rett. Thank you for your attention.